Healthcare in the United States is on a knife's edge, and the debate over what comes next is more heated than ever. Supporters of Medicare for All argue that a universal, single-payer system is not just a better option, but a far more stable and humane alternative to whatever healthcare proposal may eventually come from President Donald Trump's administration and Republican lawmakers. They see the current moment, marked by delays, leaks, and internal GOP disagreements over health policy, as proof that piecemeal fixes are no longer enough. At the center of the conversation is President Donald Trump, who has been delaying the release of his long-promised plan to address skyrocketing healthcare costs in the United States. Reports suggest that this delay stems in part from resistance within his own party in Congress, particularly around the details of subsidies and restrictions that might be included in the proposal. While the administration signals that something big is coming, the lack of clarity has opened the door for renewed calls to move in a very different direction, toward a single-payer Medicare for All system. Renewed push for Medicare for All. Senator Bernie Sanders, who caucuses with the Democrats, has been one of the loudest voices insisting that the fundamental issue is not just how to tweak insurance subsidies, but whether the country will finally recognize healthcare as a basic human right. He sharply criticizes Republicans for having plenty of ideas about how to structure healthcare markets while refusing to accept the principle that every person should be guaranteed coverage as a right, not a privilege. That framing turns the debate from a technical argument over policy design into a moral clash over what kind of country the United States wants to be. National Nurses United, a major nurses union, has also stepped up its advocacy for Medicare for All, citing fresh polling that exposes just how anxious people are about the cost of care. A recent West Health Gallup survey found that nearly half of U.S. adults, 47%, worried they will not be able to afford healthcare in the coming year, the highest share since tracking began in 2021. For Medicare for All supporters, numbers like this are not abstract, they are evidence that the current system is pushing families to the brink. The economic pressure on families. Timothy Lash, president of West Health, has emphasized that the sense of urgency is not exaggerated. He notes that families are already struggling with broader economic pressures, and even if healthcare prices were to stay flat, rising costs in other areas only make medical bills feel heavier and more overwhelming. In other words, when housing, food, and other essentials get more expensive, any unexpected medical expense can become a crisis. This dynamic fuels the argument that patchwork solutions, like small tweaks to premiums or limited subsidy adjustments, are no longer sufficient. Even modest increases or surprise bills can tip households into debt or force them to skip care altogether, which is exactly what single-payer advocates say a universal system would prevent. The tension between short-term fixes and long-term structural change sits at the heart of the current debate. A fragile deal over ACA subsidies. Earlier this month, a small group of Senate Democrats agreed to help Republicans end what had become the longest federal government shutdown in U.S. history, but the price of that cooperation was surprisingly modest. In exchange for their support, those Democrats secured only a promise to hold a vote in mid-December on extending Affordable Care Act, ACA, subsidies, which help more than 20 million Americans cope with rapidly increasing premiums. Progressive lawmakers, including Sanders, were deeply frustrated, arguing that Democrats had surrendered a major bargaining chip for a relatively weak commitment. For those on the left, the episode underscores a recurring pattern: temporary measures and last-minute negotiations that keep ACA protections alive but never fundamentally transform the healthcare system. The fact that the future of subsidies for millions of people hinges on a single upcoming vote illustrates how fragile and uncertain coverage remains under the current model. Medicare for All advocates use this precariousness as a clear example of why they believe a permanent, universal guarantee is necessary. Inside Trump's tentative healthcare framework. But here's where it gets controversial. Leaked details suggest that Trump's developing healthcare framework, informally dubbed the Healthcare Price Cuts Act, may contain changes that would significantly reshape how ACA subsidies work. According to reports based on anonymous White House sources, one key element would be an effort to address what the administration describes as surprise premium hikes. On the surface, that may sound like a move to curb costs for consumers, but critics are already warning that the fine print could tell a different story. One especially contentious idea involves eliminating so-called zero-premium plans, policies where low-income enrollees pay no monthly premium because subsidies cover the full cost. The proposal would instead require everyone to pay at least a small amount, which proponents frame as a way to combat ghost beneficiaries or people they claim are receiving coverage fraudulently. Detractors worry that even a small charge could discourage the poorest families from staying insured, effectively closing the door on those who are already most vulnerable. Shifting people into health savings accounts. Another element reportedly under consideration is a kind of incentive program that nudges people toward cheaper plans on the ACA marketplace. The idea is that if someone switches to a lower premium plan, the savings, essentially the difference in cost, would be deposited into a health savings account funded with taxpayer dollars. Supporters argue that this could encourage more cost-conscious decisions and give people a bit of extra financial cushion. Critics, however, see a familiar pattern in this approach. They worry that enticing people into lower premium options can often mean pushing them into plans with higher deductibles, narrower networks, or weaker benefits, shifting more risk and out-of-pocket costs onto patients. For Medicare for All supporters, using public money to subsidize bare-bones coverage and savings accounts is the opposite of what a truly protective system should do. Republican pushback and internal friction. In an ironic twist, Trump's healthcare concept is facing resistance not from Democrats, but from within his own party. Some Republican lawmakers, reportedly caught off guard by the scope and direction of the draft plan, have questioned whether it might include additional restrictions related to abortion, among other concerns. That uncertainty has contributed to the proposal being put on hold, leaving the public to piece together scattered leaks instead of evaluating a concrete bill. This internal gap friction feeds the perception among Medicare for All advocates that Republican healthcare policy is reactive and fragmented rather than coherent and long-term. When even members of the president's party seem unsure about the details and consequences of a major healthcare proposal, it strengthens the argument that the system is being steered by political calculations rather than a clear vision for universal, stable care. Will Democrats accept a limited deal? As more pieces of Trump's possible plan dribble into the press, some analysts believe Democrats may ultimately accept a scaled-down arrangement, at least for now. Commentators such as Ryan Cooper and David Dayen have suggested that Democrats might view this kind of compromise, extending some ACA subsidies in exchange for accepting other trade-offs, as the best they can realistically secure in the short term. From this perspective, keeping subsidies alive, even with strings attached, could be preferable to letting premiums spike dramatically. Yet those same observers also argue that this situation exposes what they see as the intellectual and moral bankruptcy of the Republican approach to healthcare. In their view, the GOP is willing to step in to prevent premiums from more than doubling for middle-class and wealthier Americans, but only if they can simultaneously reduce the quality of insurance and increase costs for poorer people. That tension, protecting some while squeezing others, lies at the core of the criticism. Sanders' broader healthcare agenda. And this is the part most people miss. Sanders' response is not limited to defending the ACA as it exists now. In recent op-eds and a letter to Democratic lawmakers, he has laid out a broader set of policies that he believes the entire Democratic caucus should rally behind, especially at a moment when Republicans are finally being forced to talk openly about the healthcare crisis. For him, this is a rare opportunity to move the conversation away from narrow subsidy debates and toward systemic reform. His list of priorities includes extending ACA tax credits so people do not lose coverage due to unaffordable premiums, reversing roughly $1 trillion in cuts that Trump and congressional Republicans previously enacted to the ACA and Medicaid, and expanding traditional Medicare to cover dental, vision, and hearing services. He also calls for slashing prescription drug costs by requiring pharmaceutical companies to charge U.S. patients no more than they do in Canada or Europe, investing in primary care so people can get help earlier and more easily, and banning practices like stock buybacks and certain dividends while placing tighter limits on CEO pay in the healthcare sector. Medicare for All as the long-term goal. Despite the fact that Medicare for All does not yet enjoy majority support even among Democratic senators, Sanders, as the top Democrat on the Senate Committee on Health, Education, Labor, and Pensions, continues to insist that it is the best long-term solution. He has reintroduced the Medicare for All Act, partnering with Democratic Representatives Pramila Jayapal of Washington and Debbie Dingell of Michigan, to keep the vision of a single-payer system on the legislative agenda. For him and other supporters, the bill is not just symbolic but a blueprint for where they believe U.S. healthcare must eventually go. From their viewpoint, incremental reforms are necessary but insufficient. They see Medicare for